Josephine Ramirez. Josephine Ramirez. Can I help you?
Yeah, you called Josephine Ramirez?
Yes.
That's me. I go by Joe, so I'd prefer to be called Joe.
Really?
Yeah.
Excuse me, I'm sorry, there must be some mistake. You signed in as Joe, but I have Josephine written down in my book. I'm sure we can fix this problem. Why don't you give me your ID and your health insurance card?
Yeah, I have all the forms.
Oh, you downloaded them from our website?
Yeah.
Okay. Is this your legal name? Okay. We will be using your legal name in the medical records. Okay? Just so you know. And I'll talk to the office administrator and see if we can't fix this. Why don't you just go ahead and have a seat? You can keep the other forms. I don't need those, but the nurse can go over those with you. Okay?
Ms. Ramirez? Ms. Josephine Ramirez?
Hi, I'm Joe Ramirez. There was a little mix-up with the paperwork. I'd like to be called Joe Ramirez.
Not a problem. I'm sorry for the mistake. If you will give me an ID, I'll take it down to the clerk to get that corrected.
I mean, I don't think that's necessary. I gave it to her already, so she's aware of the issue. It's just that I haven't changed my name legally yet on my license, so if you could please just call me Joe or Mr. Ramirez.
Okay, Joe, not a problem. I'm Rick, I'm the tech. I'll be taking vitals, so would you please come with me?
Sure.
Okay. All right, have a seat, miss. Sorry, Mr. Joe. Would you please take your clothes off and put this gown on, and I will be right back to take your vitals.
I'd rather not. I'm really just going to speak with a nurse, so.
Is there a reason why for it?
No, it's just I would really rather talk to a doctor or a nurse.
It's not going to take long, though. Plus, it will be easier for the nurse for me to do these tasks. Is everything okay?
Yeah, it's fine. I would just really rather talk to a doctor or a nurse.
I'm sorry, but did I do anything to offend you?
Yeah.
Okay, all right, I'll let the nurse know that you're ready, and they will be here shortly.
Thanks.
Hey, Rachel.
Yes?
Your patient in room 2, he doesn't want me to take his vitals.
Oh, really?
He wants to be called Joe, but her paperwork and ID says Josephine Ramirez. Right, he said I didn't do anything to offend him. I just don't know what's going on.
Okay, I'll be there soon.
All right, thank you.
Good morning. Hi, my name is Rachel. I'm going to be the nurse here with you today in the practice. I'm just coming in to just start the assessment part and also to ask you a couple questions.
Fine, yeah.
I noticed earlier with the interaction with our administrative aide and also with what the tech told me in regards to the vital signs, I just noticed that it might have made you feel a certain way. So I just wanted to kind of ask you before doing anything else in how you're doing and how you're feeling.
Yeah, thanks.
I'm so sorry for what happened earlier. I know that we have a huge learning curve. We have some things that we need to work on as a practice, but I can assure you that we are a non-discriminating practice, and we're here to provide high-quality, patient-centered care. I myself have worked with the LGBT community, not as much with the transgender community, but I am open and I am ready to learn new and better ways to make our practice better in serving your needs and serving any client or patient that comes in into our practice to meet their needs so we can give them a high quality patient-centered care. If there is any point in time where you feel like I am not meeting your needs or my staff is not meeting your needs or we're saying anything that makes you feel uncomfortable, can you please just let us know so that we can just address it immediately?
Sure, can I Can I just say ouch? Or-
Sure, you can definitely say ouch. But I mean, feel free to use any other words that you might you want to say at that time, so that I know that it's uncomfortable for you. Okay?
Sure.
How would you like for me to address you?
You could call me Joe.
Okay, great, Joe. I'm sure you probably already understand that for documentation purposes, we have to use your legal name that is indicated on your IDs. But we will definitely use your chosen name, and I will let everyone know at the practice to address you with your chosen name. Is there a particular pronoun that you would like for me to use or for us to use here in the practice?
Yeah, thanks for asking. I usually go by he, him when talking about me. I actually thought it was kind of interesting that I thought your staff would reflect that, because your forms were really progressive online, so I was kind of surprised when the clerks seemed to not get it.
And I'm sorry again for that. We've got a lot of things that we need to fix. This should not have happened, and it won't happen again. We do have a computer system that's a bit outdated.
What do you mean?
It's not programmed to meet the pathways of a transgender patient. For instance, if we have a patient or a client that comes in, let's say the computer system only recognizes males and like females. So if we have like a male patient that comes in, it's going to give me all the questions that has a physical assessment with a male patient. So for instance, it might put prostate exam, but it might not have a vaginal exam, and it might not have a pap smear. So I just wanted to let you know, sometimes you might see me kind of go to my paper to write down some notes. It's just because I want to make sure that I have all of the information that I need. But I wanted to let you know that, and we're going to work on it to fix it so that we can make it more streamlined to meet the needs of the community. Okay? All right, so we can move forward. And so what brings you here today?
Well, right now I'm covered. My insurance is through my parents,
Okay.
Obamacare, but I'm about to age out, so I kind of wanted to get some stuff done before that. Came in just for like a flu shot and a physical, but I'm not sure I want to go further.
Okay.
It's, most of the transgender people I know in the community in this area, they go to Whitman Walker or a couple of other doctors, but it can be really hard to get in because everyone's trying to get in.
Okay.
It's just that usually when I go elsewhere, the burden is on me to educate my provider, and I'm just kind of tired of being named, shamed, and blamed. So I was hoping that I could start a relationship with a provider closer to me.
Okay, and I perfectly understand. I just wanted to get just your vital signs. You don't have to take your jacket off completely. Are you able to just at least expose an arm so I can get your blood pressure and just get some simple information? And then if you want to go forward with the flu vaccine, then I can definitely administer, but the doctor will come in here and we'll talk to you. So how about that?
Sure.
Okay, all right. Hey, Dr. Smith, do you have a moment that I can talk to you about something?
Hello, Ms. Rachel. Of course. What's the matter?
Okay, so I'm very concerned
Okay.
about a new patient, that the interaction between a new patient and our staff. So the situation is, so the background is, my assessment is, my recommendation is.
All right. So thank you for sharing. Of course, I'll go in to see Joe. And then another recommendation, since you're really involved with the cultural competency of our clinic, I think you should get someone to come in to teach the whole entire staff about the transgender population as well as the LGBT population, because our clinic, it is something that we want to be known for, to be culturally sensitive.
And okay, I will definitely like to get some more information for us, so that we
fantastic.
can move forward.
Great.
Thank you very much. I'll just
thank you.
let them know that you're getting ready to come in there and talk to
Okay,
them.
thank you very
Okay,
much.
you're welcome.